And thank you for joining us for An Introduction to Tracking Post-Permanency Families webinar. I am Dejari Patterson, the Resource Library Program Director for the National Center for Enhanced Post-Adoption Support. Today we will have Sharon Vanderveer with Child Trends to discuss our Introduction to Tracking Post-Permanency Families. She will go over the Post-Adoption and Guardianship Instability, or PAGI, training toolkit. We do ask that you mute your devices and you can turn your cameras off at this time. So, Sharon, I turn it over to you.
Thanks so much, Tajari. I'm excited to share this information with everyone. And I want to note that all of the materials I'm going to talk about are freely available at the URL that's shown on this slide. So our agenda today, as Tajari said, first we're going to have an introduction of the post-permanency population, and then the majority of the talk is regarding the PAGI toolkit. And also we're going to take a closer look at the tools that are in the user guide of the PAGI toolkit. So let's get started with the post-permanency population. So let's review who it is that an agency would actually be tracking when it comes to post-permanency instability. When thinking about post-permanency supports and services, of course it's important to work with the entire family in a holistic manner. For tracking family stability, however, it makes sense to track each individual child separately. To reach all families at risk of or experiencing instability, sites need to know if any of the children in the family are experiencing challenges. So, in the graphic on this slide, each person represents one person in the post-permanency child population. First, everyone is under age 18 or whatever the jurisdiction's age of the majority is. Next, they are all either adopted, as indicated on the left side of the group in pink, or in a guardianship, indicated on the right half of the group in green. The number of adopted children compared with those in guardianships, of course, will vary across jurisdictions and probably never be 50-50 as shown here. There's another factor that can make tracking instability especially challenging that isn't shown on the previous slides. These children's adoptions or guardianships may have been finalized as long ago as 17 years or as recently as the current year. So for example, let's think about an adoptee who is currently age 16. Because of their age and because they have been adopted, they are a member of the post-permanency population. A child of this age might have been adopted 16 years ago as an infant, as shown in that little blue box on the left, or they might have been adopted in the current year at age 16, as shown on the far right of the timeline. Or they might have been adopted 6 years ago as a 10-year-old. This means that sites needs to look up at least 17 years worth of data to identify all children in the post-permanency population. Among this population, some youth are at risk of instability, indicated here in blue. Some of their families, shown in yellow or orange, are also experiencing challenges that might place them at risk of instability, but they are seeking help on their own. If the agency is the funder or provider of services, then these families may already be known to the agency. However, those who are at most risk, indicated by the blue, may be those who are not known to the agency because they are not receiving services at all. And keep in mind, too, that a family's level of risk can change over time. This means that sites need to track each child over time. Now that we've talked about who the post-permanency population is, before we get into an overview of the PAGI tool, let's talk about why we should track instability. Recognizing that tracking instability takes time and effort, remember that tracking instability is important for several reasons. First, based on existing research, an estimated 5 to 20% of children do experience post-permanence instability. However, the actual incidence of instability experiences in families, especially in specific jurisdictions, is not known. Research evidence is strong, however, that family instability is more common among adolescents and among children with behavior problems. So one of the most important uses of data tracking is that the information can be used to identify at-risk families and target them for services. Sites can use the information on the importance of tracking instability and build on it to develop pitches, fact sheets, or other materials or presentations to increase stakeholder buy-in for data tracking. Ongoing buy-in is important not only so that agencies can begin tracking data, but by making clear the importance of the activity for sustainability of the practice over time. Some things that sites can do include supplementing the information with local examples, noting that the U.S. Administration for Children and Families encourages sites to track data, and in fact, this is why the pagi tool was developed in the first place. Justifying the needs for funding needed to prevent instability by using data to describe the types of and level of needs of services in the post-permanency population. Generating evidence of service effectiveness by tracking how family instability changes or not over time. In addition, sites can review research articles, including those cited in the pagi tool user guide, to learn more about instability and risk factors. So now we're going to the actual toolkit itself. On first glance, when you review the pagi toolkit, probably the most prominent component is the downloadable tracking workbook, which comes in the format of an Excel file. The workbook includes a set of 7 tools to use for tracking instability data. The topics for each tool are listed on this slide, with each one corresponding with a worksheet tab. The first worksheet is for listing each relevant child. The last one is a summary sheet, and the worksheets in between are each for a different type of information about instability. Understandably, some sites might assume that the pagi tool is not worth reviewing further if they don't find this tool useful at this time or for their needs. However, even if a jurisdiction already has a system for gathering and tracking instability data and assessing family risk that is working, it might be worth reviewing the user's guide for ideas that might be useful for improving their existing systems. And also, please keep in mind that any aspect of the pagi tool can and should be customized for site-specific needs. So if the tracking workbook can be useful with modifications, this is definitely encouraged. Now we're going to move beyond the Excel data tracking tools and discuss additional resources, each of which can be found in the user's guide. These include factors to consider for getting started with tracking data, an outreach letter to keep in touch with families, data sources and approaches for gathering new data, and, especially important for gathering data on well-being and stability, a questionnaire to send to families, and finally, an approach for creating a list of the specific children in the post-permanency population. At the end, we'll also discuss briefly how agencies can use the data. First, the user's guide provides a few questions intended to help sites start a conversation about how to get started with tracking data. Some of these topics include how to leverage existing data. What data do they already have that might be useful? Determining what types of and the level of resources needed for an agency to be able to track data. Could they partner with service providers to develop a tracking system, for example, by learning about the types of data that providers may collect? It is also important to identify potential barriers up front so that work is not wasted. And of course, they can review the pagi toolkit and user guide to determine which tools might be useful. The user's guide also recommends the types of data that agencies are most likely to have access to and that might be useful to track. Most of these would come from their administrative data, and these include an adoption or guardianship flag. This would be a flag or a yes/no indicator on the administrative data records, signifying that a child who has entered foster care has previously been adopted or had a guardianship finalized. Re-entering foster care is one form of post-permanency instability. These indicators likely exist somewhere because they are required to be reported into the Federal Adoption and Foster Care Reporting and Analysis System. If post-adoption program managers cannot access that flag, they can create this indicator themselves by examining foster care data records over time. To do this, sites would need to determine if each child entering care has had more than one spell of time in foster care. If so, and if the child previously exited foster care to adoption and guardianship or guardianship during a previous spell in foster care, then the current entry records indicate re-entry for those children. Changes or requests for changes in subsidies, especially cancellations, might indicate instability. However, this indicator is only useful if sites know the reasons for the subsidy changes or cancellations. Like subsidy information, receipt of post-permanency services that families have received might indicate instability or a risk for instability. Keep in mind, though, that many of the families most at risk might need services but not be receiving them. States also may have data on voluntary placement agreements or relief of custody arrangements. These are arrangements in which a child enters foster care to receive services that the parent cannot provide, such as intensive mental health services. In these cases, reunification is anticipated. And of course, dissolution and termination of parental rights for the adoptive family would indicate permanent instability. Now we will turn to sources of the data on the measures we just discussed. As mentioned earlier, existing child welfare administrative data should be the first source of data explored. However, it can be useful to supplement this with other data sources. Importantly, this includes data from the Pagi Tools Wellbeing Questionnaire, which we'll talk about shortly. In addition, data sources could include service providers or agency workers based on their service records, case files, or even their personal knowledge. Agencies could also direct workers to ask a routine set of new questions upon case intake. The Pagi Toolkit includes suggested questions for this purpose, as shown here and available in the user's guide. Other valuable data may come from other agencies' administrative data systems, such as the juvenile justice, Medicaid, or behavioral health agencies. Each of these agencies sometimes provides out-of-home care placements for children. Now we come to the outreach letter. This letter is in the appendix of the user's guide, but briefly, it includes the following: a greeting. It asks how the family is doing. It requests updated contact information. It expresses the desire to provide any needed support. It explains the questionnaire if it's enclosed and provides instructions for returning it. And lastly, it expresses thanks. The letter is a friendly way to keep in regular contact with all families in the jurisdiction's post-permanency population. Agencies can and should customize this letter for their specific preferences and populations. They can also include information about post-permanency services available in a site, especially newly implemented services that families may not be aware of. Now, this slide presents some quick tips for staying in touch with the families. First, make it as easy as possible for parents to respond. For example, include a self-addressed stamped envelope, QR code or hot links, and/or phone numbers. Agencies can also request contact information for more than one person in case one person's information becomes invalid. Request contact information for both parents if applicable, as well as for the youth if possible. Consider also asking for contact information for a family friend or a relative who will most likely always know where the family is. Swag like a fridge magnet or postcards can help remind families to let the agency know of changes in contact information, as well as of the availability of services. And of course, include contact information on agency and service providers' websites. Another great tool, if an agency isn't already doing something like this, is the Wellbeing Questionnaire provided in the user's guide. This questionnaire can be sent along with the outreach letter or with any other regular communication that agencies do. The first part includes 4 yes/no questions asking directly about instability, specifically whether the child is still living at home, whether the parent or guardian is still legally responsible, whether they continue to support the child financially, and whether the child is in school. Part 2 of the questionnaire gathers data about risks for instability by asking about families' abilities to meet their child's needs. Specifically, questions ask about parents or guardians' ability to meet the child's mental health needs and physical needs, their understanding of their child's needs, their abilities to ask for help with family problems, and to solve problems with their child, as well as their abilities to access relevant and useful information. The last question asks families directly if they feel they need services, and if so, what type. Agencies can also add to the questionnaire, but the number of items should remain relatively short. For example, jurisdictions might want to add questions about common or severe threats to stability that they know are problems in their particular jurisdiction. Questions could be modified to correspond with any specific definitions that jurisdictions use. Sometimes these pertain to service eligibility or criteria for reentry into foster care. Consider including small sets of questions targeted at specific subgroups of families or one-time sets of questions, if appropriate. If questions are added, try to adapt them from vetted sources. For example, the pagi tool drew some of the questions for the questionnaire from the Family Empowerment Scale, which has been tested and used in research since 1993. And of course, drop any questions that are not useful. The last tool we'll discuss today is one for maintaining a list of children in the post-permanency population. Now, I initially said that I would not cover the Excel tools, but I am making one exception. The first table in the Excel workbook can be used on its own to create a census of the population. Having such a list is a key first step, of course. Agencies need to know who it is that they want to contact and collect information about. Otherwise, it will be impossible to do outreach to the entire population or even know whom to target for services or outreach. Each column is a different piece of information that you should collect on a child, and each row represents one child. Going from left to right, this information includes child name, foster care and adoption ID, if there is one. Next, a few demographic characteristics. And finally, there is a space to indicate adoption versus guardianship and dates of finalization. For any information that is unknown, the corresponding table cells can be left blank. As you can see, this is a very simple table, so it would be easy to edit or even create from scratch. To obtain information for the table, agencies' data departments should be able to provide child-level information on all children who are currently under age 18 and exited foster care to guardianship or adoption. Data can usually be provided in Excel or an Excel-friendly format, such as a comma-separated value file. Once the data are obtained, they can be pasted into the table. A bit of formatting may be needed. To keep the information current and comprehensive, agencies should repeat this process regularly. Subsequent data requests should use the same criteria listed above, but be limited to children who achieve permanency after the dates in the data that sites already have. Otherwise, there will be duplicate records for some children. If a data extract is not possible due to staff capacity, data could be hand-entered, but this is obviously far from ideal. Some columns that might be useful to add to this table, especially if this is the only table being used, include contact information. This way, the agency won't need to look up the contact information each time they want to contact a family on the list. Some type of ID indicating if multiple children are members of the same family would also be useful to add in an additional column. This way, agencies can send each family a single outreach letter and enclose a separate questionnaire for each child. Instability information and well-being information from the survey can be recorded in additional columns. An agency that finds the additional data tracking tools too cumbersome to use can enter any sort of notes about instability and well-being into this table in additional columns. And finally, dates that the instability information were most recently entered, and the dates of most recent attempts to contact the family and whether successful or not can also be entered in additional columns so that agencies can quickly identify how current the information is. And of course, as is with all tools, this table can be customized in any other way that agencies might find useful, including deleting columns that are not useful. I want to end with a few words about using the tracking data. Even if available data are limited, any available data should be used to help inform the level of family service needs to different families. This can be based on the different intervals of services as defined by the Post-Adoption Center, which vary in intensity as depicted on the graphic on this slide. The first level is universal and maintenance services, that is, services for all families. The outreach letter is an example here. For this level, current contact information is necessary to provide universal services. Family characteristics such as age of child or any diagnosed mental health condition or special health care need could inform the targeting of families for selective services, because instability tends to be more common among groups of families with certain characteristics. Not all families in any such group will be at risk for instability, but targeting these groups will increase the chances of reaching those families that do need help. The presence of risk factors for instability point to a need for indicated services, that is, services that meet a specific family need. And the presence of actual or imminent instability would indicate a need for the highest level of services, that is, intensive services. Information coming from the well-being questionnaire could be very useful for determining the urgency and type of response appropriate for each family, especially regarding the presence of risk factors and actual instability. If families are returning the well-being questionnaires on a rolling basis, agencies ideally should review each response as they receive it, even before entering data into the tracking tables. In fact, and this is a very important point about the utility of the PAGI toolkit, the tools we have discussed today can be used on their own without the tracking tables. I have one more final point to add. Data are not worth collecting and tracking if they are not used. During the planning stages, this will be an important factor to consider. We know that time and resources of staff working in any capacity with child welfare agencies or providers is precious. The goal of data tracking is to make outreach and service provision for the post-permanency population both more effective and efficient, and it will be worthwhile if agencies can develop data tracking approaches to accomplish these goals. And that was our last slide. We are also working on developing additional resources to support agencies' use for the PAGI tools that we didn't go over today. These will be added to the Post-Adoption Center resource library in the future. Please feel free to contact us anytime at the information shown here. We always appreciate feedback so that we can make sure our materials are clear and useful. Thanks so much, and I hope you all have a great day.